Hi, welcome to Nurse Chats. Today I'd like to talk about health in general. Can you change your health? If your first thought was no, you can say to yourself, I've been this way forever. This is what I am. This is what I experience. I'm going to tell you that you can change your health. And I want to give you hope about that because you can change. There was a book written by a gentleman who had gone to see his doctor and he had all kinds of problems, the typical problems that we hear about: high cholesterol, diabetes, pre-diabetes, whatever he had, high blood pressure, on and on, overweight. And I believe, I heard him speak once, but it's been a while, but I believe he finally said to his doctor, what do I need to do? What do I need to do to change this? And it seemed like it was going to be an impossible task. And he was like, what do I need to do? And I remember some of his 6 suggestions, but I'm going to say that they're probably universal no matter what anyway. There's certain universal things that we can do that change the course of our physical body and mental as well. And one of them we've already talked about on another nurse chat, but that's exercise. And when we talk about the word exercise, right away it conjures up ideas that I have to go to a gym, or I have to, just that, I have to. But we exercise on a daily basis by the movement we do just in our activities of daily living. So I talked about that before. Movement is a better word. So however you're moving, if it's minimal or not, or it's not changing, there's ways to help increase movement, to change the outcome from movement. That's when we have a goal, and sometimes we have a trainer, and I used to be a personal trainer. I think I said that before. And we would sit down with our clients and we'd figure out what is working and what isn't working, and then make the change as to what the goal is and what we want to accomplish. So if the goal is just how do I change my health, there are very simple strategies to just change the way you move, and or move better, and or move more. And again, I'll probably be addressing those in future nurse chats specifically. But movement can change your health depending on where you're at. I think I had a person talk to me the other day, and she was telling me that she's walking every day at lunch hour and quote unquote getting nowhere. And I just said, well, tell me exactly how you're walking. Tell me what you're doing. How fast are you going? How long are you going? And that made a difference when I gave some just simple suggestions for changing that to an interval. Instead of just walking for 10 minutes or 5 minutes or whatever it was, try walking 2 minutes faster for 2 of the minutes. If you can't do 2, do 1. So walking your regular pace, whatever that is, and then bumping up for about a minute, and then bumping back to your regular pace again. So just changing the intervals, not the time, not the commitment, not the duration, changed her body, okay, in her case. So not everybody's the same, not everybody has the same issues, but that's how I advise people when I'm listening to them and trying to figure out a new goal for them based on what they want to accomplish. Is it weight loss? Is it strength? Is it endurance? There's a variety of reasons that people want to change, and they're just not able to do what they used to do, and it's very frustrating. Okay. The next one would be obviously nutrition. So nutrition and exercise are the 2 hallmarks that everybody talks about with regard to changing your body, your health. Okay. Nutrition's a little tricky because we hear so much about it, and we hear a variety of things. And I think I even talked about nutrition once in one of these videos. And as a personal trainer, I would listen to people first and determine what they've told me that about their daily activities, about their daily life mattered, and I'd ask them, were you ever at your goal before? Or have you ever, been there where you want to be? And the person might say yes, they might say no, but either way, then we can assess what quote unquote worked in the past, what didn't work in the past, and how do we need to adjust to get to a new goal. Okay, so nutrition matters. What you put in your body, I've said this before, is a drug to your body. There is a chemical reaction with whatever you put in your body, and so health effects over time from similar or same habits regarding nutrition matter. And I think I talked in one of my nurse chats about a doctor who said, if you want to change your lifestyle and to change these lab results or to change the outcome, that's great. But words from a doctor, and she said, most people don't do it. And that was her experience. So we're going to give you drugs instead. I think most people can do it. I think I'm going to, I hope you replay this nurse chat numerous times because it's possible. It's possible to change at any age. And I used to know a lady who changed a lot of things at age 93. And she was a different person, seriously. And so that brings me to the next piece of the big pieces that change your health altogether. One of them is attitude. And she had a great attitude. And she was like, I don't want this. I'm going to live till I die. I'm not going to die before I die. And if you can understand what I'm saying, there are plenty of people who die before they die. They die mentally, they die spiritually, they die physically, and they just don't care anymore, or they just gave up because they're frustrated, or they feel crummy. We all think, you have to go out and exercise and eat right to make a big change up front. Yes, but the truth is, until you feel better, you may not be able to change everything immediately, because you have to have a positive reason for doing it. The pain and discomfort, Anthony Robbins says, the discomfort has to be so great that you want to make that change. But then there's the positive, and saying, I can make that change and I will make that change, and having the help and assistance you need to do that. So attitude is everything. And we've learned that through COVID. How you respond to an event that makes a curve in your life says a lot about where you were at baseline. And so we can change our baseline. And I want to assure you and encourage you that you can. The next habit, of course, is hydration. We talked about hydration before. Dry bones and bodies and muscles and organs don't do well. You want to hydrate, so but again, those of you on Lasix and diuretics and things, you have different issues regarding hydration, but especially if you get the flu and are losing fluids through diarrhea or throwing up. So those are different, but hydration in general helps you have a better life and a better body. And we talked about the hydration test on the hydration nurse chat, and pinching your skin and seeing if it stays up or not, and having the right blend of electrolytes with your water and salt and sugar. Okay, so those things matter, and we'll keep going back to those same things because they're the hallmark of what changes health. Okay, and then asking for help. Getting to your doctor, your practitioner, your trainer, your whoever it is that you may have in your life, that can be your coach, can be your advocate, can be your practitioner, matters. So I can't tell you how many times as a nurse I would have someone come up with cancer, and we'd say, well, how long have those symptoms been going on? Years, maybe months, but years, and we're ignored. And we all know that early detection matters in cancer. So we would be talking to a patient who had, 5 years of a symptom and ignored it. So don't ignore things. Just see if you can find help. And there's certainly plenty of help nowadays online. And I'm here to help you. So if you have other questions about how do I change my health, you need to have some muscle power to have more strength to get to be able to do things. So I'm an advocate of, again, weight resistance. Does that mean using heavy weights? No. It means what is appropriate for you and your age and your body. But yes, weight resistance matters, and standing and land exercises and water exercises versus land when you need to have movement without the pull of gravity. And you need to be buoyant, so there's a time and a place for all of it, but all of them, the goal is to increase muscle. And then cardiovascular work, when you pump up your breathing a little bit and your heart rate goes up a little bit, is great for reducing calories and certain goals again. but you have to be able to temper that and do the right and the appropriate cardiovascular exercise for your age and not overdo, okay? So that's all I have for today. And I just really look forward to seeing you guys again. And till next time, take care, okay?